Hello everyone, welcome back to sqadia.com, best medical learning platform all over the world. Today, the topic we are going to discuss is sex hormones and drugs. The ovaries and testes, in addition to producing gametes, also secrete hormones, mainly estrogens and androgens, respectively. The secretion of estrogens, mainly estradiol, and androgens, mainly testosterone, requires gonadotropins, luteinizing hormone, LH, and follicle-stimulating hormone, FSH, which are hormones released from the anterior pituitary. The release of LH and FSH is, in turn, controlled by the hypothalamus, which releases pulses of gonadotropin-releasing hormone, GnRH. In the testes, spermatozoa are produced in the seminiferous tubules by a process requiring both FSH and testosterone, the latter hormone being synthesized in the interstitial cells in response to LH. Testosterone causes the changes that occur in the normal male at puberty. Androgens are used mainly for replacement therapy in castrated males or in males who are hypogonadal either because of pituitary or testicular disease. Testosterone is rapidly inactivated by the liver following oral administration, but synthetic androgens, for example mestralone, are active orally. Anabolic steroids have relatively little androgenic activity and are used to try to increase protein synthesis after major surgery and in chronic debilitating disease. The main adverse effects of androgens, and to a lesser extent, the anabolic steroids are masculinization in women and prepubertal children and the suppression of FSH and LH. In the ovary, FSH and LH stimulates follicular development and estradiol synthesis by the granulosa cells of the follicle. In the early follicular phase, the low estradiol level in the blood exerts a negative feedback effect on FSH, ensuring that only the dominant follicle ripens. Midway through the cycle, estradiol levels are high, and this has a positive feedback effect on LH secretion, leading to the LH surge that causes ovulation. These feedback effects of estradiol are exerted on the hypothalamus, changing the amount of GnRH secreted, and the pituitary gland, altering its response to GnRH. The ruptured follicle develops into the corpus luteum, which secretes estrogen and progesterone until the end of the cycle. During the follicular phase of the cycle, estrogen stimulates endometrial proliferation. In the luteal phase, increased progesterone release stimulates the maturation and glandular development of the endometrium, which is then shed in the process of menstruation. Estrogens have many effects. They are used for hormone replacement therapy, HRT, in primary hypogonadism, and in postmenopausal women to prevent hot flushes, atrophic vaginitis, and osteoporosis. They are also used in several menstrual disorders, for example, spasmodic dysmenorrhea, and in combination with progestogens as contraceptives. Progestogens are used mainly for hormonal contraception. Sex hormones and antagonists are used in the treatment of certain cancers. GnRH, gonadorlin, is a decapeptide that stimulates FSH and LH release from the anterior pituitary gland. Pulsatile infusions of GnRH are used to treat hypothalamic hypogonadism. LH and FSH are glycoprotein hormones produced by the anterior pituitary.